Welcome everyone to this video exploring Friedreich's ataxia, a rare and challenging inherited disease. We'll delve into what causes it, how it affects the body, how it's diagnosed, and what management strategies are available. Join us as we unravel the complexities of this neurological condition. Friedreich's ataxia, or FA, is primarily caused by a genetic mutation in the FXN gene. This gene provides instructions for making a protein called frataxin, which is essential for the proper functioning of mitochondria, the powerhouses of our cells. In most individuals with FA, there's an expansion of a specific DNA sequence, a GA triplet repeat, within the XN gene. This expansion disrupts the gene's ability to produce enough functional frataxin. While less common, some individuals might inherit FA due to having other types of mutations, like point mutations or deletions in the FXN gene from both parents. Now, let's examine the pathophysiology. Reduced levels of frataxin due to the genetic mutation lead to mitochondrial dysfunction. The mitochondria become impaired in their ability to produce energy efficiently. This deficiency impacts nerve cells, particularly in the spinal cord and cerebellum, the part of the brain responsible for coordination and balance. Iron accumulates within the mitochondria, leading to oxidative stress and cellular damage. Over time, this damage causes the progressive degeneration of nerve tissue, leading to the characteristic symptoms of Friedreich's ataxia. Friedreich's ataxia is a relatively rare disease, affecting approximately 1 in 40,000 to 50,000 people worldwide. It affects males and females equally. While it can occur in various ethnic groups, it's most commonly observed in people of European descent. The typical age of onset is between 5 and 15 years, but onset can range from early childhood to adulthood. Because it's a recessive genetic condition, both parents must carry the mutated gene for a child to inherit the disease. The signs and symptoms of Friedreich's ataxia are progressive and can vary from person to person. The hallmark symptom is ataxia, which is a lack of coordination affecting gait, balance, and limb movements. Individuals often experience difficulty walking, frequent falls, and uncoordinated movements. Other common symptoms include dysarthria or slurred speech, dysphagia or difficulty swallowing, muscle weakness, fatigue, and scoliosis, a curvature of the spine. Vision and hearing problems, as well as heart problems like cardiomyopathy, are also frequently observed. In some cases, diabetes can develop. Diagnosing Friedreich's ataxia typically involves a combination of clinical evaluation, neurological examination, and genetic testing. A neurologist will assess the patient's symptoms, reflexes, coordination, and other neurological functions. Genetic testing, specifically analyzing the FXN gene for GA repeat expansions, confirms the diagnosis. Additional tests, such as nerve conduction studies, electromyography (EMG), MRI of the brain and spinal cord, and electrocardiogram (ECG), can help evaluate the extent of the disease and rule out other conditions. While Friedreich's ataxia doesn't have distinct subtypes in the traditional sense, there can be variations in the age of onset and the severity of symptoms. Some individuals may experience an earlier onset with more rapidly progressive symptoms, while others may have a later onset with a slower progression. The degree of cardiac involvement, scoliosis, and other associated conditions can also vary significantly among individuals with FA. Researchers are actively investigating these variations to better understand the disease's progression and develop more personalized treatment strategies. Currently, there is no cure for Friedreich's ataxia. Treatment focuses on managing symptoms and improving the quality of life. Physical therapy, occupational therapy, and speech therapy can help maintain strength, coordination, and communication skills. Assistive devices, such as walkers, wheelchairs, and communication aids, can help individuals maintain independence. Medications may be prescribed to manage specific symptoms, such as heart problems, diabetes, and muscle spasticity. Cardiac monitoring is crucial to detect and manage any cardiac complications. Psychological support is essential to help individuals and their families cope with the emotional challenges of living with FA. Since Friedreich's ataxia is a genetic condition, there is no way to prevent it from occurring in individuals who inherit the mutated gene. However, genetic counseling is crucial for families with a history of FA. Genetic counseling can help prospective parents understand the risk of having a child with FA and explore reproductive options, such as preimplantation genetic diagnosis or prenatal testing. Carrier testing can identify individuals who carry the mutated gene but do not have the disease themselves. The prognosis for individuals with Friedreich's ataxia varies depending on the severity of the disease and the presence of complications. The disease is progressive, and symptoms typically worsen over time. Life expectancy can be shortened, primarily due to cardiac complications. However, with appropriate medical care and management, individuals with FA can live fulfilling lives. Ongoing research efforts are focused on developing new therapies to slow or halt the progression of the disease. Promising research areas include gene therapy, which aims to correct the underlying genetic defect, and the development of drugs that increase frataxin levels or protect cells from oxidative stress. Clinical trials are underway to evaluate the safety and efficacy of these potential treatments, offering hope for the future.